So I'll be doing my presentation on manner of death. The manner of death is the deceased person's cause of death. This is important to know if you need further legal action, what's required, especially if it's like a homicide. And then the other thing is genetic. If it's genetic, knowing what caused it, if there's anything you can do to prevent it, and then doing testing to make sure that their kids or whatever are affected. A fun fact is a place to classify the manner of death was added to the U.S. Standard Certificate of Death in 1910. There are essentially 5 different causes of death: natural, accident, suicide, homicide, and undetermined. Natural being things like disease or cancer, accident, and then suicide is being like self-inflicted, homicide being like a murder, and then undetermined is after going through like a biopsy or an autopsy, being unable to determine the cause of death. There are different degrees to help determine the cause of death, first being undetermined, and this is when there is less than 50% certainty. Reasonable medical or investigative evidence is roughly 50-50 chance, with more than likely not. The preponderance of medical and investigative evidence, about 70% or higher. Clear and convincing medical or investigative evidence is about a little bit greater, and then beyond any reasonable doubt is essentially 100% certainty. And then lastly, beyond any reasonable doubt is 100% certainty. These are basic rules for classifying the manner of death after looking at like the autopsy or biopsy. What is a biopsy? A biopsy is a less invasive autopsy. This is where they use a needle or something to extract tissue from the organs without having to leave large incisions or removing organs. They usually use this when they aren't trying to make a lot of incisions and stuff, for when they're doing viewing and stuff for the body. A retrospective needle biopsy study on 394 biopsies performed between 1948 and 1968 by 32 different pathology residents in the United States revealed success rates range from 34% for the kidneys and 92% for the liver. An autopsy is essentially a little bit more of an invasive biopsy. This is when they're making those large incisions and removing the organs to make sure that they're looking further into the biopsy or autopsy. There are more advanced autopsies coming, like imaging. This is the least invasive, but some of the things that they look at for the autopsy are things like the cerebrospinal fluid, blood, liver, lungs, bone marrow, brain, kidney, spleen, and then they do a rectal swab. So determining death based on different parts of the body. When doing a biopsy, the first thing that they're going to look at is the skull, seeing if there's any trauma, skull fragments, bullet holes, cut marks, seeing if there was any force or trauma to the head is essential, especially if it's possibly a homicide. Knowing if there was a fight or anything like that and being able to determine what kind of trauma it is. Next, they're going to look at the bones, see if there's any injury, and then classifying those types of injuries as intermortem injury, premortem injury, or postmortem damage. Things like blunt force, sharp force, when injuries occurred, and then fractures. And then they're going to look into those injuries and see where the healing process is at and the location and pattern. The next thing they're going to look into is like the liver, things like the texture, the appearance, see if there's any diseases that cause death, and then the trauma. Overall, there are many different factors that determine the manner of death, but these are some of the basic things that they look at to help determine the cause of death. And then lastly, these are my references. Thank you.